For these basic lessons, your patient's incision should run from left to right in front of you. Think spay incision and how your patient is placed on the surgery table. You will not be able to move your patient during the lesson since you cannot rotate your patient on the surgery table. Your thumb forceps will be held in your left hand with a pencil grip. Your needle holders will be held in your right hand with the thumb and ring fingers in the finger rings, and your pointer finger will be extended forward. This will help you stabilize the needle holders as you push the needle through tissue. The tips of your needle holders will be used to grasp your needle 2/3 of the way along the body. Your needle will be perpendicular to your needle holders. Let's review some basic terminology. A bite is when you place your needle through the tissue. That is a bite. A throw happens when you align your needle holders between the tail and the needle of the suture. Wrap the suture around the needle holders once, grasp the tail, and pull it through. That is a throw. A knot consists of 2 throws. So that means you're going to realign your needle holders, wrap around once, grasp the suture tail, and pull it through. That is now a regular suture knot. You will hear us refer to something called a surgeon's knot. This is basically the same as a regular knot with one minor exception. You're going to go ahead and take your bite. You will realign your needle holders between the tail and the needle, wrap your suture around once, and then for a surgeon's throw, you're actually going to wrap it around twice. Grasp your tail and pull it through. Remember, this is a knot, so we need to make a second throw. Wrap around once, grasp your tail, and pull it through. That is a surgeon's knot. Okay, let's move on to a horizontal mattress suture. Now, most of your sutures, we're going to have you start with your needle so the point is facing towards you. It's a very natural position for the wrist and gives you most control over your suture. We are going to begin that way. A horizontal mattress suture is an individual suture. We are going to make our bite beginning or entrance point on the opposite side of the incision, and we're going to come out on the close side of the incision as such. At this point, I'm going to have you reverse the direction of your needle. So now the needles are in your needle holders facing the other direction. Your second bite of this knot will require you to move over about 4 to 6 millimeters. You're going to make your entrance point on the side of the incision closest to you, or close to the exit point of your first bite. Your exit point will be right next to the entrance point of your first bite, as such. There is an entrance for bite 1, an exit for bite 1, an entrance for bite 2, and an exit for bite 2. Your tail and your needle are going to be on the same side of the incision, but unlike the vertical mattress, the space is here and not here. So when you align your needle holders between the tail and the needle, your needle holders will actually be crossing over your incision. You're going to do a surgeon's knot, so it's going to be a surgeon's throw. You're going to have 2 wraparounds. Grasp your tail and pull it through. Now, remember me telling you before how you want to make sure your line is straight. If you pull it the wrong direction, you're again going to get this wonky thing. That's the granny knot and incorrect. So let me even that back out for you. Okay, that was the first throw of your surgeon's knot or your surgeon's throw. Align your needle holders up again between your tail and your needle. Wrap around once, grab the tail, and pull it through. If you remember that your needle holders in your hands, when you're making your throws, will always switch direction, that will help you remember where to keep your where to pull your needle holder to. So let's finish off that with a second knot. I'm going to realign my needle holders, wrap around once, grasp my tail, and I'm going to bring it back to the opposite side. That was my first throw, that second knot. Wrap around again once, grab your tail, pull it through. Now I'm going to be on the opposite side of where I was. That is a horizontal mattress suture. I'm going to cut my tail so that they're about 4 to 6 millimeters long. You are going to wind up seeing a little dash on this side of your incision and a little dash on that side of your incision. So let's do that one more time. We're going to take our bite, entrance point on the far side, exit point on the close side. Okay, I'm just lining that up so that you can see better. Now, reverse my needle, so it is now pointing away from me. I'm going to take bite 2, but I'm moving over just a little bit. There you go. Entrance point, first bite, exit point, first bite, entrance point, second bite, exit point, second bite. Line your needle holders up between the tail and the needle. Do your surgeon's throw. So I've got twice. Grab my tail and pull it through. Make sure that it's a straight line. Realign my needle holders, wrap around once, grab my tail, pull it through to the opposite side. Make my second knot. Wrap around once, grab my tail, wrap around once, grab my tail, and one more time. Okay, let's do that one more time. Needle points towards you. Bite 1, far side, bite, exit, close side, turn your needle around, move over a bit, entrance point, close side, exit point, far side. Align your needle holders between the tail and the needle on the suture. Wrap around twice for my surgeon's throw. Pull through. Realign. Regular throw. Knot 1. Realign. Grab the tail. Realign. Grab the tail again because you need 2 throws to make a knot. And there's your horizontal. Okay, notice your entrance and exit points should be the same distance from your incision. Your spacing between the first bite and the second bite should be equal distance, and the distance between each suture should be lined up evenly. It's going to look like you have an incision with a dotted line running along either side of your incision. And if you always start at the same point and exit the same points that we talked about, your knots will all wind up on the same side. And that is your horizontal mattress.